Okay, in this presentation, we're going to go over the special tests for the lower leg, ankle, and foot. On the slides, you will see that we have the common mechanism of injuries, signs and symptoms, and special tests. We are going to be talking about the importance of these tests, and you can read the slides for the other information, and then we will be going over all of these special tests.
So our first pathology is going to be a lateral ankle sprain. These are one of the most common injuries that we will see as athletic trainers, but they can actually lead to more serious pathologies even though they are often overlooked. After your first lateral ankle sprain, you have a 30 to 50% chance of respraining your ankle. You also increase your likelihood of osteoarthritis by 10%, and you have a really high likelihood of chronic ankle instability with each new lateral ankle sprain that you have. So to test for this, we're going to be going over the anterior drawer test, the talar tilt inversion stress test, and the glide of the subtalar joint.
Okay, now we're going to do the anterior drawer test for the ankle. This is going to be testing the ATFL ligament and its integrity. First thing we're going to do is we're going to stabilize the tibia and the fibula above the malleolus, and I'm going to contact the calcaneus with my other hand. You can keep the foot in either slight plantar flexion, usually helps. Then we're just going to put an anterior force like this. You guys can actually see that. That is a positive sign. You will notice right here, bump, bump. Positive ATFL tear. Okay, now we're going to do the talar tilt inversion test. This is a test that's indicative of a lateral ankle sprain. And what we're going to do is have the patient side lying. I'm just going to stabilize the leg here. I'm going to put the ankle in neutral. And then what I'm going to do is I'm going to abduct the ankle like this. And I'm just looking for increased range of motion compared to the other side. That would be indicative of a tear or a strain of the CFL, calcaneofibular ligament. All right, next we're going to do the subtalar glide test. We're going to have the patient seated. We're going to put their foot in a neutral position. I'm going to apply a posterior force to try to translate the talus posterior. If it moves posteriorly, that's a positive sign for a sprain or a rupture of the posterior talofibular ligament. Next, we have the medial ankle sprain. Although rare, it's very important because it's going to take about 2 to 3 weeks longer than a lateral ankle sprain to heal. This is because most of our load-bearing weight is on the inside of our ankle. Special tests we're going to be going over are the talar tilt eversion stress test and the Kleiger's external rotation test.
Alright, so we're going to be doing the talar tilt eversion stress test. So what I'm going to do is I'm going to stabilize the lower leg here. I'm going to push the foot into a neutral position, and then being careful not to rotate his foot, I'm just going to slightly evert here. So what I'm looking for is extra laxity compared to the other ankle on the medial side. This is going to be testing for the deltoid ligament, which if there's any laxity, it's going to be a medial ankle sprain. Alright, so we're going to be doing the Kleiger's external rotation test. This will be positive if he has a deltoid ligament sprain or laxity or tear. So what we're going to do is we're going to get the foot in neutral, we're going to support the calcaneus, and we're going to give it a little bit of an external rotation. And this is in the neutral position. So next we have the syndesmotic high ankle sprain. These are very similar to the medial ankle sprain in their mechanism of injuries. However, there are some key differences. Your recovery period for this pathology is going to be a lot longer. You can't weight bear with these injuries, and also the pain is going to be more anterior versus the medial ankle sprain. Some special tests that we'll be doing is the Kleiger's dorsiflexion external rotation test, the squeeze compression test, and the fibular translation test. Okay, so next we're going to be doing Kleiger's external rotation and dorsiflexion test. This is going to be for high ankle sprain. So it's the exact same as the other one. We're going to support the calcaneus, just emphasize that it's going to be in dorsiflexion, and we're going to externally rotate. So what I'm looking for is increased laxity and the recreation of pain.
Okay, now we're going to do the squeeze test. What we're looking for is pain down here in the syndesmosis. That would be indicative of a high ankle sprain or a syndesmosis sprain. I'm going to go above the calf, and I'm just going to squeeze the tibia and the fibula together, and I'm looking for positive pain in the area right here, and that would be a syndesmosis ankle sprain. Okay, now we're going to do the fibular translation test. This is going to be another test for a high ankle sprain. I'm going to be looking for pain in the anterior portion of the ankle right in here, the syndesmosis. I'm just going to be stabilizing the tibia with one hand, and I'm going to take my other hand on the fibula, and I'm just going to be pushing it anteriorly to see if there's any pain in the front of the ankle, indicative of a syndesmotic or high ankle sprain. Next up, we have medial tibial stress syndrome. There's usually involves the posterior tibialis muscle, and there's 3 grades. The first grade is when the muscle starts to pull away from the bone. The second grade is inflammation in the periosteum from the muscles. And the third grade can actually lead to a stress fracture or the bone giving way. Special tests we'll be looking at for this one are the navicular drop test. Okay, now we're going to do the navicular drop test. This test is going to be indicative of a MTSS if the navicular drops more than 10 millimeters. That's 10 mm. Okay, so first we're going to find the navicular, which is this giant prominence, bony, sticky thingy out right here. And we're going to put a little X right, pending a pen working, a little X right there. Then we're going to put the ankle in subtalar neutral, so I'm going to feel the talus and make sure it's even on both sides. And she is non-weight bearing right now with the foot just sitting in a neutral position. Now, what I'm going to have her do is I'm going to take a piece of paper and I'm going to mark the distance where that X is on the piece of paper, like so. Make sure you use the same side of the paper that touches the ground as prior. Now, can you please stand and we'll have you put some weight on that. Now, we're going to do the same thing. I'm going to put the piece of paper up here and we're going to draw another line somehow right here, and we're going to draw another line. We're looking for the distance between here to be greater than 10 millimeters. Now you guys can read it. Greater than 10 millimeters. If it is, it's indicative of MTSS.
So our next pathology is going to be stress fractures. These are common pathologies that happen over time from overuse. One of our key differentials is going to be night pain, and then we have 3 special tests to go over: the hop test, bump test, and torque test. But the hop test, which is hopping on one foot 5 times, is going to be our gold standard. Alright, so next we're going to be looking at stress fractures in either the tibia or the fibula. So we're going to have Jarrett stand and weight bear on this left leg that is injured, and we're going to have him hop 5 times. Well, he completed all 5 jumps, so therefore he does not have a stress fracture. You're no fun. Okay, so next we're also going to be testing for a stress fracture in either the tibia or the fibula. So what I'm going to do is I'm going to put the foot in neutral, and right here with my palm, going to give it a nice firm bump, and he has no pain, so there is no stress fracture. That's the bump test. If he had pain and wanted to hit me right now, likely he has a stress fracture. Alright, so last for our stress fracture tests, we're going to be doing the torque test. So what I'm going to do here is I'm going to stabilize above where I believe the fracture is. We're going to have the rest of it hanging off the table, kind of acting as an anchor, and I'm going to apply some weight here. So, positive for a stress fracture. So our next pathology is going to be compartment syndrome. Unfortunately for us as athletic trainers, there are no special tests that we can do to confirm this. However, we can look for the 5 Ps as listed in the slide. And there are 3 different types, all of which need to be immediately referred to a doctor or specialist.
Next, we have the rare but occasional Achilles tendon rupture. This rupture is not very pleasant. It hurts a lot and feels like you're getting hit in the back of the ankle with a baseball bat. This is an immediate referral to the emergency room or their doctor. Our test we will be performing is the Thompson test.
Okay, now we're going to do Thompson's test. This is a test for an Achilles tendon rupture. So what I'm going to be doing is I'm going to be simply squeezing the calf, and as you can see, her foot plantar flexes. If this doesn't happen and the foot stays here while I squeeze here, that could be indicative of a Achilles tendon rupture, and that's a referral.
Our next pathology is plantar fasciitis. This is very common and can cause pain on the bottom aspect of your foot. When you are looking at this pathology, make sure to rule out heel spurs as they are also common. The special tests for this are going to be the windlass test and the navicular drop.
Okay, now we're going to show you the windlass test. This is to test the plantar fascia. What we're looking for is reproduction of the pain or the symptoms in the plantar fascia in this vicinity. What I'm going to do is dorsiflex the foot, and then I'm going to take the big toe and pull on it, thus creating the windlass mechanism, and I'm looking for pain or inflammation or problems right here. All right, here again we're going to do the navicular drop test, but this time we're going to be doing it as indicative for plantar fasciitis. So if you remember, I already have the X right here on her navicular bone. We're going to be standing with no weight on the foot, but in neutral position. We're going to mark the navicular there. We're going to make sure the subtalar joint is in neutral, and then we're going to again take that piece of paper like this, and we're going to mark where the dot is right here, if the pen worked. And then we're going to have her stand up for me, and we're going to, she doesn't fall over. And then maybe next time, if you want, you should assist and help your clients up. Now we're going to, once again, mark the line, and we're going to be looking for an increase from here, well, there we go, from here to here. And if this distance is greater than 10 millimeters, we have a problem, Houston. Probably plantar fasciitis. Next, we have the spring ligament. This is an important ligament because if it's ruptured, we're going to lose the medial longitudinal arch. It's going to cause us to pronate more and cause the forces to be transferred into our tibia. It's going to predispose us to MTSS or even a tibial fracture. The special test we're going to do for this one is the neutral heel lateral push test.
Alright, so now we're going to be testing for spring ligament integrity by doing the neutral heel lateral push test. So to do this, I'm going to stabilize the calcaneus while making sure that my forearm is not in the way. Then I'm going to provide a little bit of pressure here. So what I'm looking for is to either recreate the medial pain or to look for laxity compared to the other leg that would indicate that the spring ligament's integrity has been compromised. Our next pathology is metatarsal fractures. Some people that are predisposed to this pathology are people with weak toe flexor strength because they help to dissipate the forces placed on the metatarsals. Some special tests to go over are the long bone compression test, the torsion test, but once you possibly diagnose this, they really need to get an x-ray to confirm.
Okay, now we're going to do the long bone compression test. This is looking for a fracture of the metatarsals in this area. What I'm going to do is I'm going to grab this little piggy here. He's going to go to the market by being pushed straight in like that.
Oh my god, ow!
Jesus, that scared me. And that piggy is hurt. Then we're going to grab piggy number 2, and we're going to push him in.
Oh, why?
Oh, jeez. Now we're going to grab piggy number 3. Push again.
Oh my god, why are you doing this?
Okay, well, piggy number 4.
Ah!
Fat piggy number 5.
No, that one's okay.
Is okay. So we have a fracture indicative because there's pain across the top 3 or 4 piggies. Okay, now we're going to do the torsion tests. This one again is going to be testing for a fracture of the metatarsals. What I'm going to do is just stabilize the upper part here, and I'm going to take the bottom part here, and I'm going to just tweak them. I'm pulling down like this, and I'm looking for extreme pain, and that would be indicative of a metatarsal fracture.
Last but certainly not least, probably my favorite, the Lisfranc injury. This is fairly rare and often goes untreated or is written off as an ankle sprain. When a Lisfranc fracture occurs and isn't treated properly, they have a higher rate of post-traumatic arthritis and misalignment when the bone is healing. So this is going to be a very important one to find and diagnose early. The test we're going to use is the torsion test.
Okay, we're going to do the mid-foot torsion test again, but this may also be indicative of a Lisfranc fracture. So I'm going to grab the top here, and I'm going to grab the bottom of the foot, and I'm just going to be torquing or torsioning down here, and I'm looking for pain in this area indicative of a Lisfranc fracture.